Hello, my name is John Dewey. I'm the owner of Fleet Feet in Greensboro and High Point, North Carolina. Also a physical therapist, and I'm here today to talk to you about a very common condition that we see in both our runners and our general population. And that condition is called plantar fasciitis. For some of you, you may hear it termed plantar heel pain, and just so you know, we're pretty much referring to the same thing. Plantar heel pain has been a newer term that's been used basically because fasciitis means that there's inflammation, and some of the deeper studies are finding that the fascia may not have inflammation, but it may be a degeneration of that fascia instead of inflammation. So let's talk a little bit about what plantar fasciitis is. So if you take the foot and you look at the bottom of the foot, there is a fascia or a connective tissue band that travels from your heel up to your metatarsal head. So you can imagine my hand here would be the plantar fascia. Now, what does that fascia do? That fascia actually acts as a structural piece to maintain your longitudinal arch, your arch of your foot, and it also helps mechanically in that when you put your foot down, it helps maintain a rigid lever so your foot can propel off, and especially while we're running, we can be more efficient when we're running. So that leads to, if you're walking a lot or you're running a lot, and this isn't functioning correctly, then you can encounter a lot of additional problems. So that is your fascia. It travels from here to here. What are the signs and symptoms of plantar fasciitis? So pretty much our telltale sign for plantar fasciitis is if you get up in the morning after sleeping however many hours during the night, and you have a very ginger walk. It's hard to put your full weight on your feet because you either have point tenderness at the bottom of your foot or throughout your whole foot, or some people describe it as like it feels almost like my foot is broken, just like a global pain in their foot. But then generally what happens is the longer you walk, the more that fascia kind of stretches out and the pain dissipates a little bit and you're able to walk. So if you're having those symptoms, you can pretty much be assured that there's some kind of involvement with that plantar fascia. Also, if you're sitting for long periods of time and you get up and you have that similar type of pain with each step, more than likely you're experiencing this condition. Like I said earlier, this affects about 1 in 6 to 1 in 10 people, and it's, millions of people in our population have this condition. And what causes it? There are a lot of different things that can contribute to plantar fasciitis. We think that it is that certain risk factors are obesity, standing on your feet all day, running or performing athletic exercise for long periods of time, inadequate support in your footwear, and we'll hit on some of these things a little later as well. So now I get to tell you about the good news. The good news with the condition of plantar heel pain or plantar fasciitis is that about 90% of people recover from this condition and can move about and can move on with their lives. There are some folks that do experience it and eventually will have to have little more of a deeper intervention, maybe surgical or some other options out there. But the majority of folks will get over plantar fasciitis with conservative treatment. So that's great news. And so what I'm here to tell you about today are some of the opportunities or some of the items that we have here at Fleet Feet that can address your needs for plantar fasciitis. So the first thing that I would say for plantar fasciitis is one of the key things that evidence shows us is that stretching that big toe, which puts that plantar fascia on a stretch, by dorsiflexing that big toe or bringing that big toe up, it puts the plantar fascia on a stretch, and that is an effective stretch for plantar fasciitis. So we want to make sure that you are doing that kind of stretch for your plantar fascia on a regular basis. One of the items that we have here at the store that works great for that is the Strasbourg sock. You can see this is a model of a foot, and you can see all this does is it's a sleeve, and you pull this up and you attach it down and you connect it, and it just puts a light pull on that toe. Some people have really difficult times doing this at night while they sleep. However, you can always do it when you get home from work, when you get done from a run. If you're watching your favorite TV show for half an hour, you can slip this thing on and it works wonders. It does a great job of pulling that big toe back and exposing that plantar fascia through here and really giving you a nice stretch, prolonged stretch in that structure. So Strasbourg sock we have here at the store. A few other things that we have. Another thing that evidence supports in our literature is orthotic therapy. So orthotic therapy is simply just putting an orthotic device in your shoe. Now, what does that do? So the orthotic device does a couple of things. One is that we're finding out that maybe instead of like what we previously thought, which was the fascia is pulling off the bone a little bit and causing micro trauma, what some folks are thinking now in research is that this fat pad is getting kind of worn down, and there's a combination of pressure and shear forces that are contributing to plantar fasciitis or plantar heel pain. And so with that, one thing that an orthotic does is give you more cushion under that heel and kind of cupping around that calcaneus or that heel bone, and making sure that it doesn't have as much shear and doesn't have as much trauma with every step. The other thing that the orthotic does is that it helps recreate that longitudinal arch, that long arch that we had said earlier, the plantar fasciitis helps create. So if that plantar fascia is not functioning correctly and is allowing your arch to drop, this can kind of help it out, especially if it just needs a little bit of support until all the acute injury is kind of out of there and you can regain normal function. So those are two things that an orthotic can really address for plantar fasciitis. And so what I would say is, if you're having plantar fasciitis, we want to get to it early. The earlier you can start treating plantar fasciitis or plantar heel pain, the better the result's going to be. So the first thing that I usually tell people is to make sure you have good footwear. Make sure you're wearing that footwear as much as you possibly can, even at home around the house. And oftentimes it helps to put an insert in that footwear that you're wearing all the time, at least to get you over that pain and discomfort that you're having with this condition. So lots of times maybe not lots of times, but there will be an occasion where somebody really doesn't want to wear an insert, and that's fine, but to get them through this condition, it may be important that they use it temporarily until they can get back to where they can function normally and not have that pain and discomfort. All right, a few other things that we have. We do have plantar fasciitis sleeves. So we have a variety of these from different manufacturers. So these plantar fasciitis sleeves, basically you put on just like a sock, and some of them have closed toes, some of them have an open. But basically what they do is they give you added compression through your longitudinal arch a little bit, kind of squeezes up on that plantar fascia and can give you some relief, especially for those folks who are on their feet all day long. Another couple of items that I'm going to show you. As a physical therapist, we do a lot of kind of manual therapy, but we also do some stretching and massage to that plantar aspect of your foot, the bottom of your foot. So here are a couple of items that we use on a regular basis. This is just a massage ball, a nice hard ball that has some spiky points to it. And you simply put that on the ground and roll your foot around it. You can roll circles back and forth. I definitely recommend this for folks who are in that early phase of plantar heel pain or plantar fasciitis, where you get up in the morning, before you take those first few steps, you have this on your bedstand, you put it on the ground, you roll your feet over it, and it'll make those first few steps a whole lot easier. So that's one thing that I recommend on a regular basis there. This is our Nano foot roller. This is a very similar utilized tool that you can put it on the ground and you can roll your foot over it. If you need a little harder surface, you can use these two edges here. But you can actually roll it over this way. You can also roll it this way. This is a great tool. You can utilize it in a bunch of different ways. We can also use this up the leg with some other conditions as well, but it's a great tool for that plantar heel pain and plantar fasciitis. And then I think the last thing that we have here would be this UFO sandal. So a lot of our folks don't necessarily want to wear their shoes inside their house. They don't want to track things in from outside, and I totally understand that. This sandal is a great sandal that is very comfortable. It gives you just a little bit of gives you some support underneath that arch area, but also gives you a lot of cushion. So like we were saying earlier, we want a lot of cushion under that heel to help with all that force that goes up into that fat pad of the heel. But we also want to maintain this arch integrity through the longitudinal arch. So this is a great sandal for that. It's very comfortable. I love wearing this around, when I'm not in my shoes. Again, great to have this next to your bed. When you get up in the morning, it'll probably be a little more comfortable than walking barefoot. So, I think we hit on most of the items that we have in the store, with the exception of probably the biggest one, and that would be footwear. So when we talk about footwear, we need to make sure that that the individual has enough cushioning under their foot to give them that shock absorption that we've been talking about, but also enough structure as well. So if you note that somebody, as we do when we do our gait analysis, and we do both three-dimensional gait analysis with our Fit ID, but now we also use a pressure plate to see what's going on dynamically in movement. And if we notice that the individual is pronating significantly or rolling to the inside, what that's going to do, you can imagine if this is the fascia and you roll to the inside, it's really going to stretch that fascia out and really probably create some pain and some irritation down where it's inserted down here at the heel bone. So what we want to do is make sure we have, again, enough cushion here, but also enough structure. So if this person is rolling to the inside, we have shoes that can give you a little more structure and support that will help kind of counterbalance that rolling to the inside. Okay, so it becomes really important to have good footwear. So the biggies that you need to take away from this talk are: what is plantar fasciitis, how to identify it, and then how to treat it. And we have a lot of solutions here at Fleet Feet Greensboro and at Fleet Feet High Point. And we are excited to help you with gait analysis, determining if you need a certain type of shoe that may address this a little bit better. But we also have all these tools in the store that you can come in and hopefully walk away with, that will help treat this condition that is so common and is really a troublesome condition that we see in many of our customers. So thanks so much for listening to us today. Please, if you need anything whatsoever, come to the store, give us a call. We're gonna help you with anything we possibly can, because we wanna make sure that you stay active, whether it's walking, jogging, running, whatever you're doing. We wanna keep you happy and healthy. Thanks. If you have any questions or comments, please enter them in the chat below, and we'll make sure to get back to you just as quickly as we can. And please like this video and subscribe to it if you found this helpful.
If you are interested in any of these products, please stop by Fleet Feet Greensboro High Point or see the links in the description below. Thanks.